Miscarriage is an unfortunately common pregnancy outcome, affecting approximately 1 in 5 pregnancies. The most common reason for miscarriage is a genetic abnormality in the fetus. This is the case in up to 70% of first trimester miscarriages. In these cases, the genetic abnormality has usually occurred spontaneously from a mistake in the DNA of that particular egg or sperm, or sometimes both. The main risk factor for this is increasing parental age, especially of the mother. Other risk factors for miscarriage include underlying medical conditions and the use of certain medications. Happily, for most women and couples, the next pregnancy will usually bring a more positive outcome, with only a marginal increase in the risk of miscarriage in the next pregnancy. However, subsequent pregnancies often bring significant anxiety, especially in the first trimester. It is therefore imperative that women and couples receive adequate reassurance and emotional care. To access this care, it's important to book with your obstetrician as soon as you know you are pregnant. I will often arrange early blood tests to ensure the pregnancy is tracking in the right direction, and then offer a dating scan in my rooms at 6.5 to 7 weeks gestation. The frequency and timing of visits thereafter is determined by your particular history and the degree of support and reassurance that you need. Unfortunately, in a small proportion of cases, the next pregnancy will not have the desired result, with approximately 2% of women experiencing 2 consecutive miscarriages and around 1% suffering 3 consecutive miscarriages. This is called recurrent miscarriage. Frustratingly, for those going through recurrent miscarriage, about half of the time no cause will be found. The good news is that the majority of these women will still achieve a healthy pregnancy with no additional interventions. However, the other 50% of cases of recurrent miscarriage are due to underlying pathology, with causes including genetic issues in one or both parents, abnormalities in the shape of a woman's uterus, hormonal issues such as poorly controlled thyroid disease or diabetes, or autoimmune disorders such as antiphospholipid syndrome. In order to determine whether or not an underlying abnormality exists, all women with recurrent miscarriage should have a number of investigations performed. Finding a cause allows for appropriate, targeted interventions personalised to your circumstances with the aim of reducing any further risk of subsequent miscarriage. I will arrange tests, including a specialist pelvic ultrasound, blood tests, and genetic testing where indicated. Where identified, most underlying conditions can be treated. For example, for couples where a genetic issue is identified, IVF with pre-implantation genetic testing may be used to avoid implantation of an affected embryo. For women with uterine abnormalities, surgery may be required prior to pregnancy. For women with hormonal abnormalities, treatment in conjunction with an endocrinologist can allow for an ongoing pregnancy to be achieved. For women with recurrent miscarriage, it is vital to contact my rooms as soon as you know you are pregnant. I then perform weekly blood tests until 12 weeks gestation, which are paired with weekly scans in my rooms from roughly 6 to 7 weeks gestation. For any woman who has experienced recurrent miscarriage or even a single miscarriage, it is ideal to arrange a pre-pregnancy counselling appointment prior to trying for your next pregnancy. This allows me to establish whether any modifiable cause for miscarriage can be found, and if so, treated, in order to optimise the chance of a healthy ongoing pregnancy next time round. It also enables us to create a support system that helps to manage the inevitable stress and anxiety that comes with being pregnant again after a miscarriage.